Hi, I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Today I'm talking about body dysmorphic disorder. And this is a video that's based on a few viewer questions. This is not to be confused, though, with gender dysphoria. That's a completely different issue. I'll have a separate video talking about that. But body dysmorphic disorder, or BDD for short, is a brain disorder that creates faulty and inaccurate perceptions about your appearance. For some people, you can even have delusional beliefs that make you think that the flaws that you see are an accurate perception. Let's look at an example of what this can look like, and this is adapted from the DSM-5 casebook. Amy works in an office as an accountant, and since she was 13, she's been excessively preoccupied with scarred skin, her thinning hair, small chest, and a mole on her face that she thinks makes her nose look gigantic. Other people would tell her that she looked fine, but she was convinced that she was ugly and hideous. She also believed that everyone in her office talked about her and made fun of her because of her appearance. She spent 5 to 6 hours a day compulsively checking all of these areas of her body, and every time she passed a mirror or a window, she'd need to adjust her hair to make it look fuller. To deal with the scarred skin, she'd use a razor blade to pick her skin to clear up the scars. She saw several dermatologists for face creams and peels, but nothing seemed to help. She also had 2 nose reduction surgeries, but she felt like the doctors botched the jobs and didn't know what they were doing. Amy missed several weeks of work because she felt that her coworkers created a hostile environment by making fun of her. She was given an ultimatum to report to work or be let go. She filed a complaint against her boss for promoting harassment in the workplace. Amy didn't date because she believed that men didn't find her attractive and only wanted to use her for sex. She often thought that life was not worth living because she had nobody who could accept her freak appearance. Family members tried to get her to see a psychiatrist, but that only made her angry because they considered her ugliness a mental disorder. Amy had been having some trouble sleeping for months and had some sleeping medications from her doctor. After she was told that she couldn't come to work because of the complaint that she filed, she took all of her sleeping pills. She sent her sister a text message saying that no one needed to worry about her anymore. Her sister, knowing Amy had been looking really depressed and withdrawn, called the police, and Amy was admitted to the hospital and treated for depression. So this is a sad story about Amy, but this is pretty typical as to how this can look. It doesn't always result in a suicide attempt, but approximately 80% of people with BDD have lifetime suicidal thoughts, and 25% of those people make an attempt. Let's look at the criteria according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. A preoccupation with one or more perceived deficits or flaws in physical appearance that are not observable or even appear slight to others. The key here is that you're preoccupied with the flaw. And so in Amy's case, she really did have a mole on her face, but she saw the mole as being so huge that it made her nose look huge. So an observer would see the mole, but they don't necessarily draw the same conclusions that the mole is so noticeable that it's worth talking about and ostracizing her about. You perform repetitive behaviors in response to the appearance concerns. Some examples of this would be mirror checking, excessive grooming, skin picking, or reassurance seeking. Or you could spend a lot of time comparing your appearance to others. And if you do this, you can stare at people in a strange way without realizing it. And this can create social problems for you, because if someone feels like they're being scanned every time they're in your presence, they may avoid you. The preoccupation causes distress or impairment in social, occupational, or other aspects of functioning. In Amy's example, she was so sure that everyone was ostracizing her that she blamed her boss for creating a hostile work environment. And then she took it to the next level of filing a complaint. That kind of stuff causes a lot of trouble The company has to get their legal department involved, and then you get a reputation for being a troublemaker. Also, Amy had no relationships because she felt unlovable. She either avoided people and didn't give them a chance, or she assumed that any interest that someone showed in her was only to use her for sex. And then just to be complete, the last criteria is that the preoccupation is not better explained by concerns with body fat or weight in an individual whose symptoms meet diagnostic criteria for an eating disorder. This is just to separate this from an eating disorder or issues related to body weight only. The majority of people, about 2/3, start having the problem in childhood or adolescence. The most common body area to be focused on is the face or the head. And the head would be things like insisting that your ears are too large or misaligned. Now, to clarify, what if you have large ears or you had to have a procedure as a child to have them pinned back? If you're bothered by this, does this mean that you have BDD? No, this is a perception problem, so it depends on how you respond to the need to have a part of your body altered. So yes, you had a procedure to have your ears pinned back. BDD develops when you continue to believe that your ears are so abnormal that everyone notices you. You spend hours preoccupied with it. Maybe you ask people repeatedly, "Do I look okay?" Do you see the difference? On average, your preoccupations occur for 3 to 8 hours a day. That's a lot of time. Think about it. If you sleep 8 hours a day, that leaves you with 16 hours left. And then let's say it takes you an hour to prepare for work or school, and then you spend 8 hours there. Now you're down to about 7 hours. And part of that is eating, driving, studying. So when are you going to have dedicated time to obsess? That's the problem. It's not dedicated time. It bleeds into the time that you're supposed to be focused on other things, and it interferes with your life activities. For example, excessive grooming is one of the things that people do. So you may need an extra 1 to 2 hours in the morning to get ready because you're always fixing things with your appearance. BDD doesn't always occur in a vacuum. It commonly occurs with major depression. The depression can develop in response to the distress and impairment that the BDD causes. And this is the case with Amy. Basically, her life was crashing down around her. Everything was messed up. Her work, her personal life, her relationships with her family. So she became so despondent and hopeless that she made a suicide attempt and ended up in the hospital. Another thing that commonly comes along with BDD is social anxiety. Amy avoided people and was very anxious around people, but it was only because of her body image issues. But some people will start off with social anxiety unrelated to the body dysmorphia, but then later develop the preoccupation with their body. To understand social anxiety, watch this video. I'll have a link in the corner and in the description. What causes this problem, you may ask? We don't know exactly. But body dysmorphic disorder has been associated with visual processing abnormalities and executive dysfunction. The person with BDD shows a bias for analyzing fine details rather than seeing a more holistic view of things. Another way of saying this is that a person with BDD has a preoccupation with negative details. So instead of seeing how your face looks on the whole, you zone in on the mole, and then the mole becomes the only thing that's important, and you assume everyone else thinks the same way that you do about how awful that one aspect of your face is. Body dysmorphic disorder is grouped with the obsessive compulsive disorders because of the obsessions with having a physical flaw with your body and the rituals and behaviors that you engage in. Likewise, the way we treat this disorder is similar to OCD, a combination of medication and cognitive behavior therapy. The goal of the therapy is to correct the false beliefs about the defects and minimize the compulsive behavior. You can't just get someone to stop believing that something is wrong with the way that they look. The therapy uses a process called cognitive restructuring to challenge how rational your thoughts are and help you find thoughts that make more sense and are actually more rational. For example, let's say I ask Amy, what's the evidence that your face and nose is keeping you from having a relationship? Amy says, I haven't had a date. I think that's pretty clear evidence. If guys didn't think I was ugly, they'd be asking me out. I say, maybe there's other reasons that you haven't had a date. You don't leave your house except to go to work. You can't date people at your work, so how can men even find you to ask you out? I want Amy to disprove her own conclusions by seeing other possibilities. Another thing that your therapist may do is decatastrophize the situation. With BDD, you have this irrational thought, but then you worry about the things that will happen if you don't perform the rituals, like checking or styling your hair for an hour or picking the scars on your skin to fix it. So, part of the therapy is that you think through the worst case scenario. Chances are what you fear will happen, like everyone laughing out loud, isn't a realistic possibility. And even if it is, you can handle it better than you think you can. Another thing your therapist can do is help you to devise coping mechanisms to help you deal with these situations if they happen the way that you think that they will. Then the other aspect of the therapy would be decreasing or eliminating the rituals or avoidance behaviors. In my video on social anxiety, I talk about building a fear ladder that you gradually expose yourself to. And this is a similar concept. You and your therapist would create a hierarchy of situations from least distressing to most distressing, and then gradually work your way down the list. Goals of the behavior therapy would be things like decreasing the reassurance seeking, re-engaging in social situations, stop studying other people's physical features, avoid looking on the internet for cosmetic options, stop looking for opportunities to look in the mirror. In fact, if you use a handheld mirror, hold it at an arm's length when you're grooming yourself. And don't get that special magnifying mirror. You don't want to focus on part of your face. You want to look at your entire face as a whole. As for medication, there isn't an FDA-approved medication for BDD, but we will use antidepressant medications like fluoxetine and escitalopram. We'll also use some of the antipsychotic medications like aripiprazole, especially if you have delusional beliefs. The treatment period is long, like a year for the therapy and the medication, and there's a high relapse rate, meaning that after your symptoms resolve, your concerns can come back at a later time, and it doesn't always have to be the same concern. It could be a different body part the next time around. I have some resources for you in the description, so take a look there. And stay tuned for my video on gender dysphoria. See you next time.